Traveling with dogs to the United States will soon get more complicated. New rules by the U.S. Centers for Disease Control and Prevention go into effect August 1st. They're designed to keep people safe from diseases such as rabies. But the federal health minister says the rules shouldn't apply to Canada. CBC's Karina Roman has more from Ottawa.
It's a new U.S. policy for the world, beginning August 1st if you want to take your dog to the U.S. The health minister says Canada was blindsided by the move.
What am I asking for? An exemption. I've been very clear with the Secretary. I think Canada should be exempt as a country that is not a source country for rabies.
Holland says meetings with his U.S. counterpart has led to some softening of the new rules, but not a full exemption yet. There will now be a grace period beyond August 1st, so people taking their dogs into the U.S., whether Canadians or returning Americans, will get a warning first if they are without a health and rabies vaccination certification from a veterinarian, and without a specific CDC form.
I just pick on my dog, Bala. So if I show up at the border with Bala, they're going to have to look at a photo and look at Bala and be comparing, is Bala the right dog? Just frankly, I don't think this is a good use of border officers' time. So there's a lot of issues at the border, whether or not, my Maltese is another Maltese, and having a border officer figure that out, I've said to the Secretary, doesn't make sense to me. Secondly, we're all for proof of vaccination. Every dog in Canada should be vaccinated against rabies. But having these forms done by veterinarians in Canada is going to take a lot of time to get that validated, as well as making sure all dogs have this chip. It's going to cost a lot of money.
The rules also include that dogs have to be at least 6 months of age and they must be microchipped. Holland warns of negative impacts to tourism in both directions and to trade and supply chains reliant on a smoothly run border. He says he is hoping saner heads prevail and says conversations with American officials are ongoing. Karina Roman, CBC News, Ottawa.
So what impact could these new rules have on travelers, including people with service animals? For that, I want to bring in Darryl Stickel. He's an executive coach who travels to the U.S. frequently for work. He's also visually impaired and travels with his service animal, Drake. Darryl, thanks so much for making time for us.
Oh, thanks for having me, Jacqueline.
So we heard our reporter, Karina, there mention that Canada said, the government said that they were blindsided by this. What was your reaction when you first heard about these new rules?
Pardon the pun, but I was blindsided as well. It's challenging enough to travel with my service animal as it is. Drake and I have to do a lot of prep work before we travel, and we need to get help and assistance in making that process run smoothly, and even then it doesn't always. Adding more complexity to the rules feels like a recipe for disaster.
Yeah, tell us more about the routine as it stands right now.
So whenever I travel with Drake, I have to get fill out a set of forms and assure that he's got his rabies vaccine. He's already microchipped. He's a service dog. He's the cost for training and developing him was between $40,000 and $50,000. He's extremely well behaved, but we still have to go through an extensive process to make sure that he's validated and certified so that the airlines will make accommodations for him. We have to get support if we're transitioning in flights. And sometimes airline personnel are fantastic, but often they're new and inexperienced and don't quite know the existing rules, let alone a new set of rules that seem more complex.
Do you have some concerns about that then in terms of how they'll be able to handle these changes?
I really do. The health minister makes a good point that it might not be the best use of the time for border personnel, but I have to say that as human beings, we don't do well with uncertainty. I teach people how to build trust. The higher the uncertainty, the more uncomfortable we become. And it feels like a crapshoot now. If we're going to add new legislation and a new set of rules that people aren't going to be completely versed on. I mean, they've got a lot going on, a lot of things to learn, a steep learning curve. Sometimes they're having a bad day. And so we get dramatically varied responses when we travel. And I'm quite concerned. And it's got me thinking twice about travel to the U.S.
You're thinking maybe you're not going to be making as many trips, Darryl?
It's just an added barrier to entry. And, I get asked to speak at universities in the U.S. on a fairly regular basis. I was nominated as one of the world's thought leaders on the topic of trust. They may have to have me come in by video moving forward, because I don't want to be stuck for hours or days because someone's made a poor decision, or to have to travel with excess lead time to make sure I can arrive at my appointed place on time.
Yeah, when we're talking about more paperwork here, Darryl, just doing that, there's added layers for you as well, and added costs to get help to do that.
Yeah, I have to pay for assistance already. This would just add to that burden. And, filling out forms is one of my least favorite things because of my visual impairment. And I often have to get help with those kinds of things. I like the idea of an exemption for Canada, but I think if we were able to create fast passes, I don't know why we couldn't do something similar for service animals, especially if somebody's traveling frequently.
Well, Darryl, it sounds like the minister isn't done fighting yet, so we'll see how this evolves. But we really appreciate you joining us and giving us your perspective today.
Thank you for your time, and thank you to your listeners.
That was Darryl Stickel joining us from Victoria.
To dig more into the new rules and the changes, I'm joined by Darren Marks. He's a veterinarian and owner of McGillivray Veterinary Hospital in Toronto. Appreciate you taking the time to talk to us. Thank you, Darren.
Thanks for having me today, Andrew.
So help us understand the new rules. What are they as far as you understand?
Basically, the rules are, well, right now, prior to August 1st, any dog that has a valid rabies certificate or vaccine certificate can travel openly over the border. And then they need to show proof of rabies vaccine to come back to Canada. Come August 1st, the rules are going to change a little bit. No dog under the age of 6 months can enter the United States. And as was previously said by the minister, all dogs will need to have valid proof of rabies as well as having a microchip. As a whole, that's not a huge difference in what has to happen traveling internationally when people go to Europe or Asia. But it is a problem now because it does require more work on behalf of the dog's owner and the veterinarian.
Yeah, and so I guess there's been a little bit of softening, right, Darren, from what we've understood. There was some concern that would have to be a government-sanctioned veterinarian, and I don't think there are that many of them now. It could just be your regular family vet. So, but that seems a little onerous. Is that your understanding?
Well, literally hot off the presses, we just got a note from the Canadian Veterinary Medical Association that the most difficult part, or having the Canadian government, the CFIA, sign off on these forms is not necessary. So, but the CDC will be creating a new form that's going to have to be signed basically every time the dog gets a rabies vaccine. A puppy who gets that vaccine, it's good for 1 year. After that, after the dog is a year and older, and as long as they have that microchip, that rabies vaccine is good for 3 years. So once we sign up on that form, then the owner can go back and forth to the United States as many times as they want over that 3-year period.
Is this necessary? I mean, just from a medical point of view, from your veterinary experience, we can get into a bit of the politics maybe a little bit too, but is it necessary? Is Canada big? Do Canadian dogs have rabies running rampant across the country that we need to have these forms? People just going on a trip across the border with their dog?
I don't think it's a necessity because I think we're all worried about rabies. Now, the United States has been canine rabies free since 2007. So whether or not that's the onus for them to put this into effect, but we don't see rabies in dogs in Canada. Ontario is a hotbed for rabies with all the wild animals, the coyotes and everything else that walk through the neighborhood. There are lots of rabies out there. They're rabid animals. But is my dog have rabies? No. I mean, Ontario requires that all puppies be vaccinated at 12 weeks of age and then boosted accordingly, which would be a year and 12 weeks of age and then every 3 years after that. So we don't see rabies in vaccinated dogs. And I believe based on the current medical care we give now, I don't think canine rabies is a huge problem on a day-to-day basis in the majority of dogs that we see in our hospitals.
I mean, Darren, I don't mean to be too flip about it, but I don't even know whether the health minister was trying to be funny, but, you know, just this idea of going to the border with your dog and having, I guess his dog's name is Bella, you know, a border officer looking at the dog and going, is that Bella? And the dog's in the car. And I mean, it kind of seems a little ridiculous. Maybe I'm going out on a limb here.
I don't disagree. I don't know what happens if I take my dog in the Nexus line. Does she get a pass too because I'm in the Nexus line? I don't know how that works. So I do think it would be a lot more onerous, and there are a lot of other things that the border agents probably do need to worry about. Canine rabies on a day-to-day basis for my dogs, your dogs that are well taken care of, probably not an issue. I mean, we do have a 8,800, 8,900 kilometer border that these animals can pass back and forth pretty freely. So
maybe there will be.
I don't know that this is the best use of everybody's time, but they didn't ask me for my opinion.
Maybe there will be paw prints for your dog so she can get a Nexus pass. We'll see. Darren, thank you. Darren Marks is a veterinarian and owner of McGillivray Veterinary Hospital in Toronto.